I'm Dr. Rob Sinnott, Chief Scientific Officer at USANA Health Sciences. Today I'm here to share some important information with you. As you know by now, COVID-19, the novel coronavirus, is spreading quickly in countries around the world. This is a very serious matter. Millions of medical practitioners and scientists are working around the clock to provide immediate care and formulate longer-term solutions. We need your help. Right now, the best strategy is to do everything possible to flatten the disease curve. That is, to slow the spread of the infection so it doesn't overwhelm the healthcare systems in your country. Every country, big and small, is facing these same challenges, so we're all in this together. Here are 3 important things that we need you to do immediately. Number 1, avoid large crowds. For example, concerts, conferences, shopping malls, or sporting events where large crowds gather, because these are settings where virus is likely to spread quickly between people. So as much as possible, avoid crowds. Number 2, do everything that you can to keep your body strong. This means eating healthy foods, particularly lots of fresh vegetables and fruits, because they contain important phytochemicals and nutrients. Seek out foods that are rich in vitamins A, C, D, and the mineral zinc, since these are important for optimal immune system functioning. Also try to consume probiotic foods like yogurt, kefir, kimchi, and foods rich in plant fibers and beta-glucans. If you are taking medications for an underlying health condition, such as diabetes, high blood pressure, or asthma, it's important that you keep taking these medications to control the underlying condition. Number 3, wash your hands frequently with soap and water, or if these are not available, use an alcohol-based hand sanitizer. Avoid handshakes, hugging, and other physical contact because people may be infected and actively shedding virus particles long before any symptoms show. If you or a family member do get sick with flu-like symptoms such as headache, runny nose, fever, cough, or shortness of breath, the first thing to do is contact your physician or healthcare practitioner immediately. If you aren't feeling well and have a fever or other flu-like symptoms, stay home to limit the spread of the virus. Experts recommend isolating until symptoms have gone away and you're cleared by your healthcare provider and public health officials. Wear a mask if you must go out to get medical care, and make sure you dispose of it properly. Once again, wash your hands frequently and cover all your coughs and sneezes. At USANA offices around the world, we have instituted many measures to stay safe. We encourage you to use these tips to protect you and your loved ones. During this time, I ask you all to stay positive. Don't listen to rumors or unqualified advice, which is now rampant on the internet. Rather, stay informed with official information from your government health agencies and the World Health Organization. Go and check these right now. This is an uncertain time. The situation is changing fast. And while the novel coronavirus is a cause for concern, please rest assured that with common sense, reasonable action, and kindness, we will all get through this together.